sodium. So these drugs, aldosterone, they basically stop the aldosterone, so there will be decreased sodium in water retention, and that sodium will enter into the urine. Okay? But as I told you, these potassium sparing diuretics, they are the least potent diuretic. If you compare this slide, you can see the excretion of the sodium with the potassium sparing and the volume of the urine. And if you can see this slide, sodium excretion and the volume of the urine, then you can see this slide, thiazide, sodium, and the volume of the urine. So this shows that these potassium sparing diuretics, they are the least potent diuretic. Okay? So sometimes because of the least potent, we combine potassium sparing diuretics with the thiazide diuretics, or sometimes with the loop diuretic. Okay? So that's why it's written over here that these drugs used as an adjunct therapy, usually with the thiazide and the loop, because they are the least potent drug. We discussed the adverse effects, that these drugs may cause hormonal imbalance. So we have gynecomastia in the males and menstrual irregularities in the female. We discussed about the gynecomastia also, the enlargement of the breast in the males on the female petrine. Okay? So this is about the potassium sparing diuretic. I think we stopped it here last time. Okay? So whatever we discussed, it was just a revision of the previous class. So as I told you in the beginning, these are the three main diuretics which are mainly used for the purpose of the diuresis. Okay? The other two diuretics we use for some other purposes. Let's see. So we have the fourth one, that we have carbonic anhydrase inhibitor. As I told you, this drug we don't use for increasing the production of the urine, but we use for other pharmacological purpose. For example, some of the carbonic anhydrase inhibitor we use for the treatment of decreasing the intraocular pressure in the glaucoma. Okay? We also use these kind of the diuretic for the mountain sickness. Okay? So what is their mechanism? If you see this drug, acetazolamide, they basically inhibit the enzyme which is called as carbonic anhydrase in the proximal tubular of the epithelial cells of the kidney. Okay? Now how this drug will work, if you can see on the screen here. Here you can see here we have a lumen, and then we have this epithelial cell of the renal tubule, which is the pink, and then we have this is the blood part. So this acetazolamide basically stops the breakdown of carbonic acid, H2CO3. Because of this carbonic acid, what will happen? When this breakdown is stopped, this hydrogen ion, are you following me? This hydrogen ion will be decreased with the exchange of the sodium. So when this hydrogen ion does not go out, this sodium does not go inside. So what will happen? This hydrogen, because of the decreased production of this hydrogen ion, this will not combine with the bicarbonate. HCO3 is a bicarbonate and H2CO3 is the carbonic acid. Okay? So what will happen? This again you can see there is no formation of the or there is no breakdown of the carbonic acid. Okay? So because of this, what you will see the as I told you, these drugs will use for the treatment of the glaucoma. So because of that, because of inhibiting the breakdown of this carbonic acid, these drugs will decrease the aqueous humor secretion. Okay? So because of the aqueous humor, what will happen? The intraocular pressure in the eye will be reduced. Okay? So that's why we say they are called as carbonic anhydrase inhibitor. And these drugs will stop or block the enzyme carbonic anhydrase, which is responsible for the breakdown of the carbonic acid into bicarb. You got the point? Okay? So this is the mechanism of the acetazolamide. Now you will see that since these drugs will stop the breakdown of the carbonic acid, so what will happen? We have more carbonic acid in the epithelial cell of the renal tubule, and we lost the bicarbonates. Are you getting me? We lost the bicarbonates because these drugs will stop the breakdown. Because of this carbonic acid, you will see one of the main adverse effects of acetazolamide is metabolic acidosis. Okay? You will see that one of the main adverse effects, because these drugs will inhibit the breakdown of the carbonic acid. Is it clear? Okay, or you want me to repeat? Is it clear? Okay. So the main mechanism, yes please. So the main mechanism of these drugs, that they are inhibiting the enzyme carbonic anhydrase, which is responsible for the breakdown of this H2CO3, which is a carbonic acid, into bicarb and the hydrogen. You got the point? Is it clear?
Yeah, it will break down.
It will stop the breakdown.
Okay.
Okay, because this is carbonic anhydrase act over here. Okay, this carbonic anhydrase is responsible for breakdown of carbonic acid to bicarb and the hydrogen. You got the point?
Yeah.
Now, when there is a breakdown, this hydrogen will go out in the exchange of the sodium, and then this hydrogen will combine with HCO3 and will again cause the carbonic acid. This carbonic acid will again break down into water and carbon dioxide. Now, because of that, what will happen? We have an increase in the aqueous humor. Those who have an already increased intraocular pressure, if the aqueous humor secretion is increased, so that will further damages the eye. Got my point? So what is the purpose of giving this drug? We need to stop this breakdown. Is it clear? So when we stop this breakdown, so what will happen? This hydrogen, the availability is decreased. So there is no exchange of the sodium. Okay? And what will happen? These hydrogen will not combine with the bicarb. So again you see there is no breakdown of the carbonic acid. Is it clear? Now because of this carbonic acid, now we have increased amount of carbonic acid here. Because of this carbonic acid, one of the main adverse effects with these drugs is the metabolic acidosis. So metabolic acidosis, basically in simple words we can say that there is an increase in the amount of the acid in the blood. So that we say it is called as a metabolic acidosis. Okay? So this is the carbonic anhydrase inhibitor. As I told you, we use this drug. You can see the sodium excretion is very low, volume of the urine is also low. So we don't use these diuretics mainly for the purpose of diuresis. Yes, diuretic effect is there, but we don't use mainly for the purpose of the diuresis. Why we use? We use this drug for the treatment of the glaucoma. And I explained to you yesterday also, I think day before yesterday, that glaucoma is a pathological condition in which we have an increase in the intraocular pressure. And why we have increase in the intraocular pressure? Because in glaucoma there is a damage in the optic nerve. We also discussed two types of the glaucoma last time, open angle glaucoma and the closed angle glaucoma. I told you the difference that open angle means their angle is open, so the drainage is there. So because of the drainage, aqueous humor drainage, the intraocular pressure is slowly built up. That needs to be treated, but it's not an emergency condition. But closed angle, since the angle is closed, so there is no drainage of aqueous humor at all. So what will happen? The intraocular pressure will rapidly build up. And we say this is an emergency condition. We need to treat this condition as soon as possible. You got my point? Okay. So this is we use for the treatment of the glaucoma. So carbonic anhydrase inhibitors are more often used for their other pharmacological actions rather than for their diuretic effect, because they are much less efficacious than the thiazide or the loop diuretic. Okay. Now in short we say thiazide is the preferred choice for the treatment of the hypertensive patient. Loop diuretic is the preferred choice for treating the edema. Okay. And then loop diuretic, I also told you that we prefer loop diuretic in those patients where we have a decreased production of the urine. And then we discuss potassium sparing. When we give potassium sparing, whether we have the problem of, in some patients we have the problem of the hypokalemia. So in order to overcome that one, we give the potassium sparing diuretic. As I told you, first we need to give the potassium supplement, or we tell the patient to take the diet rich in potassium. If it is not corrected, then we combine with potassium sparing diuretic with thiazide or loop, one of them. So if you give thiazide or potassium in combination, that hypokalemia will be overcome. Okay. Then we discuss about the carbonic anhydrase. So we discuss that these drugs we use for the purpose of the glaucoma and also use for the mountain sickness. We have an adverse effect, as I told you, metabolic acidosis, hypokalemia, and then we have a renal stone formation. We know that these stone formation, they are the stones in the kidney, they are made of calcium oxalate stone. And these calcium oxalate stones, they precipitate in the acidic medium. So that's why you will see those who have a stone formation. So usually the doctor, they give a sharab, a syrup, which is a urinary alkalinizer. So that will make the urine alkaline, so that stone will not precipitate. since we have metabolic acidosis, so this may cause the formation of the renal stones also. You got my point? Okay. So this is about the carbonate anhydrase inhibitor. Then we have the fifth type of the diuretic, which is called as an osmotic diuretic. Again, this diuretic will not use basically for the purpose of the diuretic. The primary effect of these diuretic involves an increased fluid loss caused by the osmotic active diuretic molecule. This results in reduced sodium and water reabsorption from the proximal tubule and the descending loop of the Henry. So as I told you that we use these drugs for the treatment of the patient with the increased intracranial pressure or acute renal failure. Because of the, we discussed last time also that in some pathological conditions we have this problem of increased intracranial pressure. What is cranium? Brain, okay, layer of the brain. So we say that these drugs basically used to decrease the intracranial pressure, but you will see because of their osmotic effect, one of the main problems with the use of these diuretics that the patient may have dehydration or the patient may have the hyponatremia because of the excess excretion of the sodium. An additional contribution to these diuretics induced by that osmotic diuresis an increase in the renal blood flow that follows their administration. So mainly we use these drugs to increase the intracranial pressure or to increase the blood flow in the patient with the renal failure. Okay, because we know that when you give these kind of the diuretics, okay, so because of the fluid accumulation, if there is an increase in the intracranial pressure, that pressure will be reduced. So as I told you again, rarely use these kind of the diuretic. So these are the adverse effects. Then we have the dehydration and the hyponatremia. Then we move to the last slide, very important slide. If you remember in the beginning that I told you that the main problem with the use of these diuretic is the electrolyte abnormality. We have other adverse effects also, but those other effects are reversible. The main problem is the electrolyte abnormality. We discussed last time also potassium, calcium, chloride, all these are very, very important. Okay? If you have a low level of the calcium in the blood, that is again the problem. If you have a high level of the calcium, it's the problem. If you have a high level of the potassium in the blood, it's a problem because we know that potassium is very important for the conduction of the heart. If you have low level of the potassium, again it's a problem. So you can see this slide. We'll go one by one. Sodium excretion, in which case it is high. If you see thiazide, loop, potassium sparing or the acetazolamide. So it's clearly we have a loop diuretic. And we also discussed that loop diuretic is the most efficacious diuretic because if you see the mechanism, they inhibit sodium, potassium, 2-chlorine co-transport. Okay? So sodium excretion is high with the loop. If you see the potassium, thiazide and loop almost same. Okay? And then we have a potassium sparing diuretic. I explained you why they spare the potassium. And then we have calcium excretion. We discussed with these thiazides, they inhibit the secretion of the calcium. So that's why we use for the treatment of the hypercalciuria, one of the main clinical use of the thiazide. And then we will see the volume of the urine with the loop diuretic. The volume of the urine is too much. And that's why we also discussed with the loop diuretic, the sodium excretion is too much. So we don't prefer in normal hypertensive patients, okay, because of hypovolemia or shock, if you see the adverse effects of these drugs. So this is about the diuretic. Diuretic are one of the main drug for treating the hypertension. If you see the drugs used for the hypertension, you will also find that diuretic. There are many classes of the hypertensive drugs, inshallah, we'll be discussing onwards now, today onwards. And then this diuretic also one of the main class of the drug which are used for the part of the hypertensive pharmacotherapy. Okay? As I told you that nowadays thiazide diuretic, they are available in combination with the hypertensive drugs. Okay, so we have antihypertensive and then we have the diuretic drug to increase the production of the urine. Okay, because some patient you will see in our extremities, the lower extremities, you will see there is an accumulation of the fluid. And because of the accumulation of the fluid, there is an increase in the blood volume. So we need to reduce that. Yes, please.
Doctor, on the previous slide, there is something written down there. We can see it.
Can only be.
Yeah, I try to see this one.
Can only be given intravenous.
Yeah, intravenous, yeah. But you can see in the iPad, right? You can see?
No, it's cut.
It's exactly what you have, the same. We see only the upper half.
I don't know how it is done. Okay, let's see. But these drugs, as I told you, we only be giving as an intravenous. There is osmotic diuretic, we don't give oral. Okay? I think this is the point written over here also. You can see? This- Okay, but as I told you, this point is written there that we can only give these drugs as an intravenous administration. Yes, please, any question? I'm just giving you 2-3 minutes. If you have any